Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, super excited to have you here because we're bringing you real conversations with exceptional healthcare leaders that are painstakingly shaping the future of healthcare. And we're really passionate around healthcare innovation, leadership, access, and innovation adoption. And if it's your first time tuning in, let me just sort of take a quick step back to tell you why we're doing what we're doing and the reason sort of for our existence here. So we're focused on bringing stories of innovation to life, not just the things that you typically like to hear about in headlines, but real stories. What does it take to get things done? And the aim is highlighting real folks that are in the trenches, getting stuff done, and giving them the opportunity and the platform to be able to share their story with our community and ultimately with the world. And if you haven't checked out any of the historical interviews, make sure that you go back, check some of them out. We've had some amazing guests that have come onto the show, but make sure you hit the subscribe button now, wherever you are, so that any new interviews that come out, they come right into your inbox. So our field, it's constantly evolving. Things are moving quickly. You have to be on your toes, and it's crucial to have leaders who can envision the future differently, that are eagerly embracing innovation, and they're addressing a lot of these pressing challenges that we're going through right now. And our next guest on the show is actually one of these leaders getting a lot of stuff done. So I'm thrilled to have a visionary leader that's exceptionally in the industry, Rick Goddard, who's the vice president and head of commercialization and strategy at Lumeris. His work's critical. I mean, he's been guiding healthcare organizations throughout the majority of his career, especially as they navigate a lot of these complex waters of value-based care and risk. Now, Rick's path to healthcare strategy, it didn't start yesterday. He's been around the block for a little while, and he's an executive leader. Prior to this was at Advocate Physician Partners, where he was in charge of the clinical innovation department. There, he played a pivotal role in administering the largest ACO in the country, diving deep into population health analytics, value-based payment, and rolling out innovative strategies. And as a national voice on value-based healthcare strategy, Rick is frequently sharing his insights freely at universities with professional groups, shaping the conversation of where healthcare is going. And he's going to share some of that knowledge today, making how to make healthcare better and his experience in pushing the industry towards value-based care and his vision of the future in healthcare. So Rick, welcome to the show. It's great to have you. It's good to see you again. How are you?
I'm great, Michael. Thank you so much for having me.
Yeah,
Uh,
man. So let me ask you, what what are you excited about? As there's a lot going on, but like what has got you really excited lately?
well, I'm excited to be a learning father.
Right
Uh,
on.
like you have younger children. Um, I'm learning over and over again how to be a different human and self-respect to how do you grow people that are not at the maturity level yet, shape them, help them to be good people. Uh, think about my own respect. How do I become a better person? It's kind of nice to have that introspection in your
Yeah.
life.
Yeah.
I don't think I've done this much introspection in a long time, but what makes me excited about it is you get to learn something brand new. And I think partially core to probably what we'll talk about today is a
Yeah.
quarter to what drives me is what is learning. So that's what's most exciting at the moment.
That's so good because I mean, would you mind maybe just sharing a little bit about your journey? We've talked a little bit about it in your intro, but sometimes it's nicer to hear it directly from the source, as far as your journey into healthcare leadership. And it sounds like education, growth, mindset, that drives you every day. But give us a little bit more about your journey and where you are now.
Well, I haven't interviewed in a while. Been at Lumeris for roughly
It's not an
7 years.
interview. This is a conversation. It's a conversation.
Well, what I'd say, what I'm saying going into this is what I'd say in an interview on the one thing is I'm a consultant by training, but a health system leader by background. Um, and so that comes from core of I think you could joke about with most administrators that we've grown up in the ranks. At some point, we wanted to be doctors. We were thinking about how do I get into medicine, and bio or what chem gets you in pre-med, and you're like, well, maybe I'm not as good at the sciences, but I want to be a part of something where it's going to be shaping the future of what our system is. So got that really started at the University of Illinois in Champaign, and started to learn what are the right positioning to be a healthcare leader. So I think like anybody that's been on your show, they'd listen to a lot of mentors. You have the ability when you're a student to have that unique access point to any leader that's a willing person to mentorship. And you find a way to talk to people that are high, low, early, long stage, retired, and they could tell you everything in the world because they want to know what and potentially shape a student that could be making a good or bad decision on where they're going to go. So through a lot of informational interviews, going down that health administration route was important to me. So in the 2000s decade, when I came up in this era, um, hospital administration was key. Like that was something where
Mm,
hospitals were the place to where you start to cut your teeth. Physician groups and insurance and pharma, like that didn't really come into play unless you're going from an MBA after a few years of being in the work. So you're thinking about what should be the course of action getting to this. Went directly to the hospital route, got my grad program at Rush University. It's a management master in health systems management. But what was great about that program is it allowed me to get job experience. You actually get to work while you're in school. So I had some really interesting internships that were able to teach me a lot about what healthcare executives are thinking in the real world. So like you could talk about
yeah,
academia all day,
yeah.
and talk about where, even when we're talking practice of where healthcare is going today, you could look at it from a very academic lens, or you can just roll up your
Mm,
sleeves and get to work.
yeah,
I think at that point that taught me I'm sick of school. I'm sick of getting grades for stuff. I want to get some practice on things. And no disrespect to the academic community at all, because I think it plays a pivotal role in many different facets. In fact, I'd love at some point to teach. But I learned a ton about where you should grow and how you should follow your path. The one particular mentor at the time shared with me at this stage early in your career, you don't pick a subject matter expertise. Try to fit as far as you can, as wide as you can, experiences, because that's going to shape your perspective, shape what you like and what you don't like. You get access to
yeah,
options. I
yeah,
think my dad, probably your dad said it as well. Grade school, getting good grades at school is not about always, there's many parts of the learning, but if you get better grades, you have more options. And I think that stuck with me throughout life.
mm,
And so fast forward to where I'm in my career, went through a bunch of different places, mostly in hospital administration, most of the academic medical centers where I live still in Chicago, Illinois, land. I live in Naperville these days. Um, and went on to consulting, which gave me the broadest aspect of different markets. And so the other mentor said, hey, zoom in, zoom out.
mm,
Consultancy gives you an opportunity to zoom out, be a bunch of different markets. Then opportunity comes where you go back in.
yeah,
And I had an opportunity to be an advocate for a bit, as you mentioned, being rolling up my sleeves to get the actual execution components of
yeah.
value-based care. And then that brought me here. But happy to go dig a little deeper. I hope.
Well, as you were zooming in and zooming out, were there a common core set of theme problems that you saw throughout, whether you were zooming in or zooming out? And if so, what were they?
Most frequent one is healthcare is local. It's consistently
Yeah.
inconsistent. There
Mm,
is there are common themes of challenge of what faces leaders every day. There could be macro trends that are affecting, and we'll talk a little bit about that. But
yeah.
everyone has their own local situation that they're working out with. It might be the team that they've built, the payers that are around them, the history and the culture of the organization that drives what the future thinking is. The environment of the community. How's the social determinants affecting the community's ability to execute on access?
Mm.
Everything you've learned can easily be disrupted by the fact that you don't understand the community and what the people deal with day in, day out. So you have to get in and roll up your sleeves.
So when you think about innovation, how do you define it? And has that changed over the course of your career?
a really good question. I think it has. I think but will the willingness to accept change continues to
Mm,
drive what I consider to be innovation. I think it comes with the ability to execute, absolutely. But if you have the will, and some organizations don't have the will, then that's what keeps you at the status quo.
mm. So what strategies do you think anybody could deploy to encourage innovation, within a team construct, within a community construct, so that those new ideas are supported and developed?
It's from first thing is leadership. So is the leader in that organization going to immediately stifle innovation, or are they going to support it and let it to be nurtured?
Mm,
Um, and then you can start to heal and craft the community and the culture of that organization. And maybe it's just a small team, or maybe it's just a project that's a skunk works. That person's setting the tone. And if they're also let to create their own, you have a lot of autonomous people, or maybe you have
yeah.
people that really like to be told certain things. Even, the folks that aren't necessarily the conceptual folks, they are very
Hmm.
innovative. They just require the
Hmm.
structure to be very innovative. And so, how do you work with those different personalities to have a cohesive, diversive thought perspective? And man, you can create something magical when you're allowing yourself to be diverse within those different teams, archetypes, organizational thought. Because ultimately, if you just think that you're innovative, it's never enough.
Yeah. Before we dive into sort of Lumeris and some of the problems you're solving, for those unfamiliar, could you briefly explain the concept of value-based care and its significance in today's healthcare landscape?
Absolutely. So I'll be using some fuzzy terms, and as you interview a lot of healthcare people, you probably see a lot of acronyms.
Yeah.
So the evolution of the term about value-based care in simplicity is maybe not as polar opposite, but rather the major difference to what we operate as a healthcare system today under a unit-based system called fee-for-service. When we sit down at the dinner table, at the Thanksgiving dinner table, we talk about how are you liking your care today on the basis of, you just go into the office, you get a bill for it. You get an MRI for it. Something problem you have, you get a bill for it. Could be coming from different people, could be coming from
Right.
twice. It's just a system that is paid on units. And it's fairly simple in that matter because units are relatable to people and then they can manage
Right.
a revenue and cost associated with those units, and you're looking at the variable economics associated. But the way that model incentivizes things today is units slash volume is then related to the revenue associated with the business. So you're incentivizing, we're talking about behavioral economics today, you're
Yeah.
incentivizing people to get people in whether they need it or not, or you get people in and you're only managing them when they're already sick. So the concept of value-based care comes into it on the basis of you can be a part of a payment model that allows you to be incentivized from, let's just say, the payer. It could be the government, it could be a
Right.
commercial payer, to be paid a certain way so you can keep people healthy while you are incentivized through this lump sum, could be in cash flow position up front, could be in the
Right.
back end later. But you are not incentivized by units. You're incentivized by the ability to keep people healthy so they don't end up in those high cost settings that
Right.
ultimately are very expensive, both for the patient and the payer. So as a provider, you're deciding yourself, how are you going to change your revenue flow? Do you care now more to be thinking like, how do I operate more like an insurer and potentially be the insurer? Or do I continue to operate on the path of I'm just going to take a price times that unit to be
Hmm.
ultimately how I receive my revenue?
Mm. So in your experience, there's a lot of noise around value-based care, and I'm just trying to think what are the misconceptions that both professionals or patients for that matter have around value-based care?
Well, there's a lot of folks that think anytime you go through, let's just say a hype cycle. I like to reference the Gartner hype cycle a lot. Um, Essentially where there's just a ton of people focused on it. You're going up the hill, then it goes rapidly down, and then there's a way forward eventually. So much like the adoption curve, or we're talking
Yeah.
about, you know, first to moves and others. Value-based care has been around a long time. 30 plus years. And some people even look back to the 90s when capitation was not friendly to providers and insurance companies didn't create a lot of access. The concept of providers being able to be in control of the premium dollar that they're working directly with employers creates a different set of incentives for the downstream providers to help people get healthy. So when I'm getting to the point of there's a lot of buzz in any of these hype cycles about words like this. Is it still working? The
Yeah.
problem is people don't fully understand it, and the people that are executing it are working. Now, the major thing is you need to get to economies of scale. So, um, a health system today has roughly, and I'm going to say about 1 to 7, maybe 10% of their total revenue in a value-based care contract across the country.
One to
That's not
seven,
enough.
1 to 7%.
Yeah, across the country, um, as their percent of total revenue. Not in any business model where you're trying to balance changing a paradigm where these two potentially
Yeah.
conflicting business models sit on the same income statement to where they require totally different change mechanisms. And so where there has two potentially opposing things in their income statement, one's going to dominate if it still retains dominance.
But what's the thinking behind that? Is that just so executives can appease, some of those, so maybe some stakeholders that want to be doing value-based care, and yet maybe there's a hesitation because they don't want to blow up their main economic engine and fully shift over? Like, what's the thinking behind that? Because it's like, obviously you're not going to please everyone, but it appears as though that there's an element of trying to please, but at the same time, let's not risk the main thing that is keeping the mission going, keeping the lights on. Is that the thinking, or is this something different? I'm just trying to
Yeah,
wrap
so
my
I
arms around it.
it's also very logical if you're looking at balancing the risk and also the concepts and the skill sets of what you know from your whole
Yeah,
career. So just to get to the point of like just for so the listeners really see this is in anything you need to get to an economy of scale in order for the decision to proceed with us to scale it. Hence, value-based care is on the precipice to being at that tipping point, as we like
that's right.
always like learning about tipping points from several of our the similar authors that we like. But it needs to reach that platform. So getting to your question, thinking about how the last 10 years happened, particularly through COVID. COVID was a breaking point of the system that could have been all the way to a reason to move into value-based care. But I'll tell you what, in something very unique. So for those that are remembers or at least students of what happened during COVID to the healthcare business models. So the health systems and the physician groups decided that they are going to be the public good. They are going to support all the people that are coming into their hospitals on the inflow of the amount of patients that are needing all the support to support the COVID pandemic. And then in tune, the government and also voluntarily in some cases, they shut down elective cases, which elective cases for health systems and surgeries are on a contribution margin basis where they make most of their money, or especially if they have a lot of commercial lives to support that. So without the elective cases and this influx of inpatient, still it requires a lot of operational costs to keep these people healthy. So in many cases, they're balancing 0% margins to negative margins just to stay alive. Now,
Yeah,
remember, the units dropped, the volume of the cases supported. So people didn't go to the doctor. People normally go to the doctor to just do checkups, stay well, not let things advance. Sedentary lifestyle settle in, right? So at the same time, the payers were making a lot of money because they weren't paying out medical costs,
Right.
because people weren't going to get their elective cases, doing the preventative situation. And what also happened is these physician groups, these independent physician groups that are operating their own independent businesses, didn't have the volume. So what's happening? They're going belly up in their own business model. What was interesting is some of the physician groups that were taking value-based care models really seriously, they're getting these cash flow from this thing called capitation, which is can be a payment from the payer on a per member per month or per member per year basis.
Yeah.
Most of it's PMPM. And they're getting that cash flow to sustain operations. And they're also participating in the premium in some cases where they're sharing in the business model that the payers are reaping the benefits of at that moment. So coming out of COVID, you could have said, well, this fee-for-service business model is not making sense in any pandemic situation where we're trying to keep people healthy or we're trying to survive. And something interesting happened. We did human nature. We went back to just doing what we know and said, hey, let's open up the pipeline of commercial elective cases and let's backfill. And we all assumed immediately that utilization would come back, but people were still putting off care. They were nervous. So that took the utilization curve to come back up until this year and last. And so you look at all the quarterly earnings of the payers, utilization was a really tough year for the payers.
Right.
Providers finally were getting a way back if they were still on the fee-for-service journey. But I use that example of like looking at history and being like, let's look at the macroeconomics. Things changed even during that period. The payers had a lot of corporate strategists were like, this is going to end eventually. So how do we
Yeah.
get involved in managing where the flow of dollars go? So when the providers came back from the pandemic, and how does my market changed? Significantly in some cases. The payers invested in those markets. Some of them bought these physicians. And so they're creating the vertical integration differences that you see today. Um, the community mix changed. You know, some people left. The demographics are different.
Right.
So those independent local markets, when I talk about healthcare is local, each one could have had a major different impact to what they woke up to. But what we did as human nature in some cases is, well, I'm good at this thing called cost shifting, which is essentially you're trying to attain as much commercial payer mix
Right.
to offset some of the payer mixes like Medicaid and Medicare that are at the cost line or below. And that's how you make your margin. That traditional business model is not sustainable anymore, especially with the way markets have changed.
So you mentioned you put a post on LinkedIn, and I want to kind of take a quote from it. You said coasting till retirement on an outdated skill set is not a good strategy. In today's payer provider landscape, successful provider executives must possess a unique skill set to diversify their organization's business model. It's no longer enough to rely solely on fee-for-service models via cost shifting. COVID volume slumps, post-COVID payer mix shifts have proven that. The future lies in value-based models that adopt many payer competencies where improved patient outcomes, prevention, and cost effectiveness are paramount. I mean, it's basically what you've just kind of articulated there. Interesting.
It's something I think a lot about for me as a provider, longtime provider, is I think we are all in tune to what we're doing in our day-to-day jobs as important, and it is. But if we don't follow macro trends that then translate into micro trends for your own area, it
Mhm.
could be a phasing out of your job, could be a phasing out of where the puck's moving for your organization. Yet you have to stay in tune to it. If we're going to all follow what's happening, and then several of your guests have talked about in the new age of AI, we also have to be very focused in where the business is traveling.
Yeah. So when you think about some of these breakthroughs, uh, oftentimes breakthroughs in one field, can inform another. Is there an industry or a field seemingly unrelated to healthcare that from which maybe you, your team, your leaders at Lumeris draw inspiration or ideas from, for innovation?
Hard to avoid the tech industry right now. That is really driving across all industries. they are creating unit value that is also scalable to where our industry has really been struggling with our operational costs for years, many times on things that no one in the organization probably wants to do.
Right.
Um, and so the efficiencies gained on the tech side that have filled in jobs for people that also have depleted or left is something where I'm going to see a lot of efficiency gained in the next 3 years. Um,
Hmm.
and also with the shortage of physicians, um, all the nursing workforce, the allied health profession, we've been hearing for what, 15, 20 years that they're shorted, and they're going to be even more of a problem in the next 10. Well, so for a while there, we were like, what are we gonna do? Sit on our hands and just wait for the wave to come?
Yeah.
I was just worried. I mean, everybody had that level of anxiety. It's like, well, it's gonna happen. How are we gonna be ready for it? But then something interesting happened, as we've all seen, is, 15 years of different forms of AI in play, but now the ability to see even an agentic AI having the ability to do tasks that can be critically thought without much direction is going to change the way primary care is delivered, how people will stay healthy, how they
Hmm.
communicate with their own bodies. I mean, I have an Aura ring because I really wanted to see how that's going to affect even just my own decision making, you know? Um, and I think everybody's probably to a little bit degree interested in their own behavioral economics for why you do things. I I think the key to the future of anything in healthcare is going to rely on the individual consumer and their ability to decide how they're going to keep themselves healthy. Um, and how they're going to navigate their own care, much less interact with the system. The open question is what is from a sociological perspective,
Yeah.
is everybody going to be thinking like that to drive the future? So leveraging a lot of the tools that we're seeing, and that's what Lumeris is really tracking to,
Yeah.
is
So
how do we create at scale?
let's talk about that because there's this gap. Health systems have done things for a long time in a similar way. And you mentioned it a little bit about the human side of change and that change management portion. What have been some of the successful things that you and the team have done to get people to kind of shift not only their thinking, but also their behavior? And maybe what do some of those successes look like at scale, as you had mentioned?
Yeah, so thankfully been here at Lumeris 7 years now. Learned a lot about behavior change because it's some of the hardest things, and you've known this for very much so, Michael, is like we can't move the masses without a ton of change management programs in place. Um, but what I've learned from Lumeris is we focus really well in doing this with the clinician community. This is a requirement for value-based care to be successful is you're putting in place the incentives for the physicians and their care teams to do things that's beneficial to the patient and for their long-term quality as well as their cost trend. So there's certain levers that we pull at Lumeris, at least studied for the last 20 years of operation,
Hmm.
um, that work better than others in terms of the drivers that, make change within that organization. It's a mix of the governance, his leadership leading from the top down and setting the right accountabilities. It's the funds flow for how the physicians are paid. Um, it's the ease of operations to do the things that they need to do. It's the individual practice redesign. So one of the things that we were talking about, like economies of scale, we also look at that at the physician level. So if you only have 10% of your patient panel that's doing a value-based care thing, you're going to continue to see 20 patients a day in your normal schedule, churning through
Right.
patients every 10, 15 minutes. If you have 60, 50, 60% of your contracts that are in a risk-bearing arrangement or something that requires that you're going to be paid differently,
Hmm.
We call this thing mind share, where that changes that clinician's management of their operational workflow. So they're going to be like, okay, I got to close all the gaps in care for this particular patient in order to meet not only the guidelines of the contracts that the payers are putting
Right.
in place, but you're also putting in place um, a mechanism to communicate more eye to eye with their patient, more time to talk to them, thinking through what is exactly the things that are bothering them from a social demographics perspective. Like maybe there is a change that a community health worker needs to come to their house to fix things for them,
Yeah.
or do basic things that they don't have access to transportation. Maybe they didn't show up for years because nobody got a call or give them a ride or a bus. Their bus stop changed. Like we don't get that time with humans when you're rushed to
Yeah.
get, oh, I had to remember to go through these 5 things with Dr. Willis. Like I usually I can't even remember the things that I was supposed to talk to with my PCP on my annual wellness visit. But with that amount of time and the way that he's going from 20 to maybe 10 patients they
Mm.
see a day with longer periods of time, and the ability to do not a ton of documentation at night because the way that their tech flow has changed, you're changed person and it gives the joy of medicine back to the actual clinician. But you give them all these things at once, plus that economy of scale and the way that they're getting paid, it creates a cycle where it's it's something where they're actually seeing the process in action versus something they're just saying, all right, I'm going to be paid in retrospect, 60
Mm.
days from now. And that's it.
Yeah. So in essence, it sounds like we're saying, hey, we're not doing this to you. We're doing this for you. And these are some
Yeah.
of the approaches that we get to have physicians, unwire and rewire in a sense, the way that they've been trained. You, how long could that take? I mean, are you talking this can happen in a matter of from deployment of something to it being going live? Are you talking weeks, months, years? What are we talking about here in terms of time?
It varies, right? But what I'm trying to stick to is if you put those levers in place, like the governance structure, you have strong medical leaders that are going to support the process and change. There's going to be doubters. Absolutely, there will be. There's politics in any part of change management. But
Mm.
if you have a resilient set of leaders from the top and through the team that are willing to make sacrifices in the near term, which is just general pain of change, they're going to they've recognized, and several clinicians throughout the country have
Yeah.
recognized that it was all worth it.
Hmm. So where do you see right now where the biggest gaps in healthcare lie, where innovative solutions are needed?
Well, there is a good amount of thought to the payment changes have not been in place yet. So there's got to be a lot of focus on how do they talk to payers to change the way that they do business.
Hmm.
There is also this concept that value-based care is in a bit of a bear market because we talk about that populism we talked about earlier
Yeah.
is, well, you heard from a friend that's not going well or like people aren't adopting it, or utilization's back for payers and it's not great to take risk contracts. So it's like this reemergence of um, the naysayers in the market that have been saying like, well, we doing this old way business is the only way to do business. We were right the whole time.
Right.
But this is also the time where you invest in the market change and the payers that are coming to the table saying, I can't afford to lose all this money on utilization. What if there's a teamwork effort in play that can happen? And then a massive change in policy happens. Medicare Advantage is something that's going to be the forward, not going to be something that's going to be regulatorily slumped on. So how do you start to then look at that strategy? It's like, maybe I shouldn't look at this from a negative viewpoint on utilization. Maybe this is a buying opportunity, right? Buy when there is a
Yeah,
bear
exactly.
market.
It's a, yeah, yeah. That's when you make massive gains for sure.
Absolutely.
Absolutely. Couldn't agree with you more there.
So filling into the actual point of you saying like, what's the challenge is how do you decide the transformational change when not everybody's on your side to make the change? It comes from that that leaders that sing through the trees, not just, it doesn't require a 10-year outlook. It's a 3-year outlook.
Yeah.
That the market has changed. Look at COVID in 3 years. And that was a massive, unless the health system was way ahead of that, that was a way that the payers really gained ground. It doesn't have to be us versus them. They can do us and them together for the benefit of the patient. This is the time to forge those partnerships. Because if it gets at a distance again, or one is really, let's not use the word leverage, but one's out leveraging the other and market position, what have you, it's harder to come back together, right? So if they're together at a time of like, hey, we need to get something and build some ideas together, man, what an opportunity.
It just seems as though that there, like you mentioned, that there's this apprehension, us versus them. What ties that together? And I frame that, and I'd be remiss if I didn't bring this up because I know we talked about this prior, but some of your stories around your triathlons that you've done over the years and what it took to go from one level to the next level. What do you think it's going to take for a health system to go from where they are to that next level? And you could use the story around the triathlon to really bring this to light.
So interesting you mentioned that. So my background, so some good mental health support and physical shape support has always been around doing something athletically. But it's also kind of something I'm wired to do challenges and try to make myself healthier. I started my triathlon journey in 2010. Anybody that's done the Chicago Triathlon, it is relatively attainable. It just requires some like decent training. And I just did 3 years in a row, Michael, where I get out. So if everybody's familiar with triathlon, you swim for a little bit, you bike for a little bit, and in these Olympic style distances, and then you run. I'd get off the bike and I would cramp up, and I'd be that guy on the side of the runway with just pain and lockup, and I didn't even know what it meant. But always being an athlete, you just didn't realize why is this happening to me? Well, obvious ones, you didn't train enough, right? You don't train enough. You don't really have a good vision for where the future goes. You just really don't, you don't prioritize maybe because you don't know it, or you just are generally lazy. But I just decided that the third time of not doing it right, should probably get some help, be a coach or research. First time I researched a ton, got a lot better, but a coach is what really took me to the next level. And I started doing longer distance racing. I did a few half Ironmans and ultimately a couple irons. And that just required counsel to maintain yourself, to have that accountability to train 6 to 7 days a week, for a certain amount of period of time. But it also, the mental stability of maintaining it with all the other stressors in your life, to have like a common vision and focus of where you're going to go. So if you had you define a true north in anything you do, it's gonna keep you focused towards that goal. Be it faith, be it the work that you're doing at work, to think, hey, I got to get to a work goal, but it requires these set of principles. Within my triathlon, it just, even through like painstaking long races. One of the races I did in Madison a couple of years ago, it rained the whole time for 14 hours, and it was cold, it was miserable. But there's reasons for you just keep going, is because your body prepared, your coach prepared you, your mental stability prepared you, and your physical training did. Well, how I relate that to like health systems and how we've been thinking about it. We've been surviving for hundreds of years under this model.
Right.
We've been thinking about how do we change ourselves? How do we improve ourselves? Little pieces here and there. The quality improvement stuff has been instrumental in the change of American healthcare. Health systems are at the forefront of that. Physicians that were leading the new breakthroughs and change. Um, I find that there's still that period where we have to do some introspection. Are we going to be what is going to be our next iteration of our challenge that we want to overcome? this is a period where we pick our next battle. We
That's
pick
right.
our challenge,
That's right.
but we decide, do we want to have a coach for that? Do we decide we want to look at who are traditional people that we were competing with, or rather on the other end of the spectrum, are they a partner or foe? This is the time where you take that look introspectively to say, how are we going to survive the next 100 years, or perhaps thrive? So that's how I look at it, Michael.
Interesting. As you kind of were framing that up, a famous proverb came to me, and it says, plans fail for lack of counsel, but with many advisors, they succeed. It sounds like what you're saying is that, look, if you're in this grueling race that we're in, and you want to finish the race and do well, you're going to need some coaching. So how can folks follow what you're doing, what Lumeris is doing? Give us, as we kind of cross the finish line here, share with us how we can follow your work and where we can kind of keep track of some of the cool stuff that you and the team are doing. It sounds like there's been a lot of little wins, by the way. I'd say not little, but big wins that you guys have had over the course of the last few months.
Didn't talk a ton about Lumeris, but Lumeris is an end-to-end operating partner for physicians and health systems to basically take on that risk, or take on that value-based set of populations to advance their journey. And certainly follow me on LinkedIn. Shoot me a note. I'm one that's always interested in networking. But also, Lumeris is here to support a variety of organizations, and certainly follow us on our website. But stay tuned. There's be another big year.
Awesome. So then last thing we usually ask our guests this is we're all about taking action, taking the right action. So someone who's listened to this conversation and there's been a lot of golden nuggets in it, what's one thing that you would suggest they take action on? What is that one thing?
I'd rather make it as simple as possible. Take action on yourself. You can control only yourself. And that, whether it's like you just decide you're going to be a gritty person today, or you're going to decide that you're going to be a good complimenting person and you want to focus on philanthropy and you want to be giving back, just decide that you're going to make that step today and not delay it.
Rick, this has been awesome. So for those that have tuned in, if you found this conversation helpful, enlightening, would you mind sharing it, liking it, engaging with it, letting us know what stood out for you? Because at the end of the day, Rick's right. It's about making that decision, not just today, every single day. You make that decision, you take the right steps. So Rick, it's great to have you on. And then of course, we're happy to have you come on. We always leave the door open for guests to come back and share other little wins, share learnings. That's what we're all about here. So great to see you again.
You too, Michael. Thanks for the time, everybody, and have a happy holidays.